Just ahead on American Black Journal, race, health, and the COVID-19 outbreak. We're going to take a look at how health disparities are having an impact on the spread of the virus in communities of color. Plus, we'll meet up with a master storyteller from Detroit. Stay right there. American Black Journal starts now.
MASCO Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. MASCO and its family of companies, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Ally, NISSAN Foundation, and viewers like you. Thank you.
Welcome to American Black Journal. I'm Stephen Henderson, and we're continuing to produce this program remotely. I am at home, as you should be, during the pandemic of the coronavirus. Although this virus is affecting people all over the country and all over the world, it's communities of color that tend to get hit harder because of poverty and underlying health issues. The U.S. Surgeon General has identified cities like Detroit, New Orleans, and Chicago as coronavirus hotspots. I had a frank discussion about the connection between race, health, and this pandemic with Harvard University public health professor David Williams and with Michael Rafferty, who's president of New Detroit. So, Mike, I'm going to start with you. You and I have had this conversation before. This was your idea to try to convene this conversation right now during the pandemic. But it's an issue we deal with consistently, especially here in the city of Detroit, the deficits that we see with regard to public health, with access to resources, and the connection between those deficits and systemic racism and systemic poverty are very clear every day here in the city of Detroit. But they really get spotlighted by something like a pandemic, and that explains the suffering that we're experiencing right now.
Yeah, and I want to say thanks for taking that conversation and entertaining it and hosting us here. And for context, New Detroit, for those of you who don't know, is an organization that was formed in the late 60s to understand and address institutional and structural racism in the region. And one of the things that as we have spent time trying to understand racism and trying to come up with the right interventions, one of the things that we notice time and time again, not just in the region and in the city, but across the country, is that healthcare is one major area where we notice rampant disparity. A quarter, roughly, of Detroiters report that they can't access healthcare because of cost. Detroit drastically outpaces the nation and the state in diabetes and asthma rates. And it's things like that that give us reason to have concern, and we should have had concern, quite frankly, much earlier about the effects of a pandemic, the effects of any sort of major healthcare crisis, in the city of Detroit and cities like Detroit. And those two data points that I mentioned speak to income, but when we intersect income and race, we notice that across the country, things like mortality rates during childbirth, Black women tend to die 2.5 times more during childbirth than white women. When you start looking at things like that, it's obvious that healthcare and health quality is one area that I think should be met with greater urgency at all times. But, right now, as we're looking at, the overall system, and this community particularly, we have to brace ourselves, and we have to start thinking now about how we advocate locally and nationally for major systemic change.
Yeah. Professor Williams, I've said in a couple of conversations since this started that we've got to talk about this in connection with things like systemic racism, the history of systemic racism, the history of systemic poverty in this country. A lot of times when I say that, depending on the audience that I'm saying it in front of, I get a little bit of an eye roll, right? People either doubting that that's the case, or maybe not quite understanding how that connection works. I wonder if you can just kind of walk us through the ways in which those things, those dynamics play such a prominent role in people's lives, but especially at a time like this.
Sure, really great question. The good news is the coronavirus does not discriminate. And so we see very prominent world figures like Prince Charles or the Prime Minister of England, or my president, the president of Harvard University, and his wife have both tested positive for the coronavirus on the one hand. So it's an equal opportunity in terms of its impact. But the question is, not everyone is equally prepared because of existing inequities in terms of health problems. We know that the virus is going to have a more negative effect on persons with underlying health conditions. What we have known for 100 years is that African Americans have higher rates of illness, and they get sick at younger ages, and they are more likely to have co-occurring illnesses, diabetes and high blood pressure, so that it puts them at higher risk. In addition to that, what are the economic resources that you can mobilize in order to respond to and try to navigate this virus? Here again, African Americans are disadvantaged. I often cite the statistic, which is true. It's national data for the United States from the US Census Bureau. In 2015, African Americans earned 59 cents for every dollar of income that whites earned. And what's stunning about that is identical to the racial gap in income in 1978. Wow. In 1978, the peak year of gains as a result of the civil rights movement and the anti-poverty policies of the 60s and 70s, the gap had been narrowed to 59 cents. It had been worse than that. And in 2015, we're still where we were in 78. And it's not that we've been consistently at 59 cents throughout those years. We fell throughout the decade of the 1980s. The decade of Reaganomics was not good for the African American community. And it was not until 1994 we got back above the 59 cents figure, but we are penny up and down from that every year. And as bad as the income data looks, it dramatically understates the racial differences in economic resources. What do I mean by that? Well, income only captures the flow of resources into the households. It tells us nothing about the economic reserves that households have to cushion shortfalls of income. We get that from data on wealth. And for every dollar of wealth, again, national data for the United States, every dollar of wealth white households have, Black households have 6 pennies, and Hispanic households have 7 pennies. So we are starting from both from a health perspective and from a resource perspective. We are starting way behind, and this virus is going to have a disproportionate negative impact on the African American community.
Yeah. Mike, here in Detroit, one of the things that I've noticed that I haven't seen a lot of people focus on is the ways in which disparities, racial disparities, economic disparities for a population like Detroit also play out in terms of the behavioral response to something like coronavirus. And so one of the ways that this continues to spread in the city, for instance, is because people continue to do things that are fairly risky. And I feel like that's happening in part because there's an information deficit that they suffer, as well as the economic deficits, and there's a trust deficit. I think I hear a lot of people saying, well, I'm not sure I can get this. I'm not sure Black people can get this. I'm not sure it will spread if I go play basketball in the park tomorrow. These things play out. It sort of cascades, right? It starts with these economic deficits and it just spreads to everything. And it makes it harder to deal with something that is so unexpected and that we weren't prepared for in the first place.
Yeah. No, you couldn't have said that better, Stephen. I think, there's an infrastructure deficit in places like Detroit, and a disparity between places like Detroit and say, other parts of the region, places of wealth like Oakland County. Information comes in differently, and can come in differently in places where you have, high poverty. I think we all have, relatively good access to good information right now. I think, Mayor Duggan and the city have taken this very seriously. I think Governor Whitmer has taken it very seriously, and have made sure that information about, what's happening and what we should be doing collectively and socially, has gotten out there pretty. We've been saturated at this point. But then you get to the trust point and the trust factor. And, quite frankly, when you're looking at hundreds of years of, interpersonal and institutional engagement, as a people, that isn't always in our best interest, quite frankly, yes, it is difficult for us to hear those sorts of things from government, from institutions, and be able to say, well, is that really the case? And yeah, I live in the city, not too far from you. And, I live, in a place that's, pretty high, it's dense and lots of people, are out and about. I've had to go out and get groceries and that sort of thing. And, it's obvious, when I get out that, not everyone is taking this as seriously as they should. Even though, we're both standing next to the same newsstand that says COVID, be careful, social distancing, et cetera. So I think you're right. First off, it is a matter of like how the information is getting out there. The second is, people have to live, and I'm actually gonna add a third point to this. When we're thinking about sort of the economic factors that play out long term, there's a short-term factor too. When there some of the stats that I've heard is that the unemployment rate is going to go up to something near 30%, which is something we haven't seen in this country, in a very long time, if ever. And there are a number of people who I've seen out actually trying to get money, trying to find a way to bring in revenue, trying to find food and other resources. And, on some level, I think the behavior that you're seeing is certainly a resistance because of lack of trust. But on the other side, it's because there are basic needs that people are still seeking, as they're going out.
Yeah. Professor, I always like to try to draw some hope or optimism out of every situation. I wonder what your work, what your study of history and the ways in which systemic racism and poverty have affected the African-American population tell you about solutions or the potential for solutions to things like this. I mean, I think we're all bracing for catastrophic consequences from what is going on right now, but there will be a day when we're past it. There will be a day when we go back to some normalcy. What are some of the things we ought to be thinking about when we get to that?
Well, I think what the research tells us, we know what the causes of the problems are. We know it's systemic racism. More specifically, it's the residential segregation that was developed as an explicit policy to protect white families from contact with blacks, and that has been entrenched in place in the United States. One historian writing a book about residential segregation argued it was one of the single most successful domestic policies of the 20th century in the United States. And how powerful it is it? And what are its consequences? One of my colleagues at Harvard, a renowned economist, David Cutler, did a national analysis for the United States, looking at the impact of residential segregation. And he showed statistically, if you could eliminate residential segregation in America overnight, you would eliminate completely Black-white differences in income, in education, and in unemployment, and reduce Black-white differences in single motherhoods by 2/3. All of those differences are linked to opportunity that are allocated in the United States by place, by where you live. So clearly what we need for Detroit, for poor Black communities, for poor Latino communities, for poor communities in Appalachia, we need a Marshall Plan to improve access to opportunity. I'm talking about quality of education, access to employment opportunities, ladders that provide a future for young people growing up so they have something to hope for and something to look forward to. So yes, this pandemic is gonna have adverse consequences. Could it be a moment of truth where America can get the political will, can empathize with the plight of the disadvantaged and decide that this is unacceptable in our great nation, and we will work together to provide a future for every child, regardless of the color of their skin?
This is unprecedented. We know that. It's unprecedented in terms of depth and scale. And when things like this have historically happened across, across the country or across the globe, it becomes a time for, comprehensive evolution. The markets change, behavior changes, policy is forced to change. Some of the things that we're talking about in this call, in this conversation is, where we have failed, where we failed socially, where we failed as a unified social system over the course of hundreds of years, but certainly and egregiously now after we've been talking about things like civil rights for as long as we have. I think it's times like this when you shine a light on some of those gaps and some of those crevices that really need to be thought through. I think right now the value proposition for major systemic change in a direction toward racial equity is going to be deeply highlighted, but unfortunately by a body count. That becomes the value proposition from, I would say the federal government all the way down to, local decision makers. And, it's interesting that we have this unique opportunity for change at the federal level. This happens to be, a time where I think a lot of Americans are stroking their chins over what they really want in leadership. It is the government's responsibility to protect. It has been the government's responsibility to protect. We hear a lot about the federal government right now about the response time. I think, like I said, Duncan and Whitmer did a fantastic job of making up for a lot of those gaps. But there are things that are deeply embedded in the fabric of the way that we behave and the fabric of the policies that dictate how we do things that needs to be rethought. And it is going to be an opportunity for folks like me to step in and support evolution behaviorally, politically, on a policy level, institutionally, support that evolution in the right way.
Although COVID-19 is dominating the headlines, we understand the need to take a break sometimes from the news about the virus. So today we're bringing you a report on native Detroiter Shannon Cason. His podcast, Homemade Stories, is popular all over the country. And Shannon calls his stories brutally honest, and he encourages people to step out of their comfort zones in the quest to tell better stories. One Detroit's Bill Kubota caught up with Shannon at a podcast festival last summer.
Went to a local computer store, got me a mic, and started doing podcasts. My name is Shannon Cason, and I'm a storyteller. You ready to hear some stories from some people?
When Shannon Cason started recording his Homemade Stories podcast, he was on the front end of the boom.
You got a podcast? No, I saw somebody over here. Who else got a podcast? Anybody else?
It's a podcast festival in downtown Detroit. This is its second year.
It's what you're doing right now, which is coming together to listen to a whole bunch of really, really good audio stories.
As storytellers practice their art, for so many, podcasts have become their delivery system.
I was born in Sinai Hospital, right?
This night, Glenn Washington, host of the public radio Snap Judgment program and podcast, is Cason's featured guest.
It's wonderful, really, to see so many elements of Detroit storytelling come together. This is really one of the places where I think that storytelling, this whole new sort of art form is being created. And Shannon Cason's, he's one of the atlases holding things together.
Welcome to Homemade Stories 109. I've been telling people for a long time, I'm slow. I'm slow in all things. The way I talk, the way I walk. I have long strides. I'm 6'3". So it seems like I'm walking fast, but it's a steady gait. You like that word, gait? The stories that I tell are from my life, everyday life, and then some are more dramatic.
The casino was a 10-minute drive, Motor City Casino. This is in Detroit. The dealer deals the cards. I lose. And then I chase till I lose the whole $50,000.
And I had no creative aspirations at all. I just wanted to be a good operations manager at a plumbing wholesale warehouse in Flint. Then in Chicago with a decent salary. Then I got laid off. Then I went broke. Then my wife left me with my 3-month-old baby daughter. And I went to a bar to learn the old-fashioned art of becoming a drunk. And it happened to be a storytelling event.
That's the whole thing about Shannon. Shannon just says, forget all that noise. I'm going to tell you what really happened. You can listen if you want. You can believe if you want. But I don't care. I'm just going to tell you what happened to me.
I was just a 12-year-old kid growing up. I got arrested going to my Boy Scout meeting. And I had $1, so I stopped at the corner store to get some Better Made Red Hot chips and a Faygo Peach, my favorite. But when you in that situation and when you with friends, we all looked at it as kind of funny. Now, I hate it when people talk bad about my neighborhood, but there was a drug raid going down at the corner store. One of the officers, huge guy, dressed like a Ninja Turtle, he asked me what you was doing out there. Like we had jokes about it. We would laugh about it at school the next day, you know. Like, man, you look so scared. And I know he saw my fear. I told him I was just going to my Boy Scout meeting. And he smacked me. I cried laughing after that happened. It's how you cope. Traumatic experiences, things happen, and in your eyes, it's funny, but your brain is just trying to make you cope. Yeah, I was actually headed to Boy Scouts, and he smacked me again. So I'm not dumb. The next time I just told him what he wanted to hear. Sir, I was out there, and I was on the corner, and I was selling drugs. Then he didn't smack me anymore. Get ready. Yeah, we're at WDET Studios. And Naila's gonna be coming in, and she's the one who,
Okay, great.
What's up? I use this studio for a new project I'm working on called In Good Company. In Good Company, I'm telling entrepreneurs business stories in Detroit.
I got my first taste of entrepreneurship in elementary school.
I'm just getting that rich Detroit story.
I've been doing this 12 years. I just got on payroll about a year ago. So the first 11 years of this company, I was working for free. I wasn't taking home a check at all, and I was doing it gladly because
and that's what
it was
you
a labor of
envisioned
love.
From the start.
Yeah.
You said that to yourself.
I didn't know it was going to take that long.
I know at this point,
Yeah.
I've been doing podcasting for
Absolutely. Not.
close to 10 years
None of the
now.
other ones.
We got something.
I'm 44 now, but all those experiences I had in that, all that struggle, all that time, I just consider it raw materials for stories now. My car went out today. I find a story about that. You know, my wife left me and took the kid, and I lost all the money at the casino. I don't know.
That's our program for today. Thanks for joining us. You can see more of my interviews at AmericanBlackJournal.org. And as always, you can connect with us on Facebook and on Twitter. Stay home, stay safe, and we'll see you next time.
MASCO Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. MASCO and its family of companies, serving Michigan communities since 1929.
Support also provided by the W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
The DTE Foundation proudly supports 50 years of American Black Journal in covering African American history, culture, and politics. The DTE Foundation and American Black Journal, partners in presenting African American perspectives about our communities and in our world.
Also brought to you by Ally, NISSAN Foundation, and viewers like you. Thank you.